welcome to the special broadcast. Welcome to our show, Health and Wellness, Myths and Facts. Now, the definition of health goes way beyond the absence of disease. The pandemic has put mental as well as physical health and wellness into sharp focus now. An awareness of health issues is important for visibility, and it's become more visibly important and the community as well. The absence, inaccessibility or inaccuracy of information about chronic illness causes a lack of knowledge as well, which is worsened by the myths and fears as well as increased social media trust as well. Obesity, for example, continues to be a significant public health crisis. The pandemic only exacerbated the problem that was already quickly accelerating in the last decade or so. The pandemic also revealed how the growth in obesity threatens the health of both the individuals and also the healthcare system. Especially in India, obesity has reached epidemic proportions in the 21st century. Obesity increases the risk of several debilitating and deadly diseases as well, including diabetes, heart diseases, and some forms of cancer as well. That's right. Obesity is a disease and must be treated as one. And we have an expert panel with us today to discuss the problems associated with obesity and its solutions as well. So let me welcome on the program. Joining us today is Dr. Hamid Ashraf. He is MD, DM, Endocrinology Assistant Professor at the Rajiv Gandhi Center for Diabetes and Endocrinology, the JN Medical College at AMU Aligarh. Thank you so much for speaking with NDTV, Doctor. Also with us is Dr. Anupam Kumar Singh. He is MBBS, MD, General Medicine, DM, Cardiologist at the Sparsh Clinic in Ranchi. Let me take the first question to Dr. Ashraf then. Dr. Ashraf, obesity is one of the major nutrition-related disorders, right? Other than nutrition, what do you think are the other factors responsible for causing obesity?
Yeah, definitely. Obesity is, as you have already talked, that it is a big problem across the world. Both developed and developing nations, they are facing this disease. And if you talk about children, that around 40 million kids less than 5 years of age, they are having obesity. And and between 5 to 18 years, around 340 million kids across the world, they are having obesity. And nutrition plays a big role in obesity because availability of energy dense and nutrition poor foods. Along with that, there is junk foods that are available. But they are not the only cause of obesity. Apart from foods, there are certain multiple other causes which can lead to obesity. One of the very important risk factors apart from nutrition is physical inactivity. As the affluences is increasing and urbanization is increasing, that is leading to decline in physical activity levels of both adults as well as kids. So that's why this epidemic of obesity is increasing day by day. Apart from that, increase in screen time is also a big problem nowadays, especially if we talk about kids. In post-COVID era, or everything is on online mode, so their screen time has increased, and different studies have shown if the screen time is more than 2 hours, then there is increased chances of obesity. And every 1 hour increase in screen time is associated with 2% increase in incidence of obesity. Apart from these things, there are also other causes. For example, certain medical conditions can be associated with obesity, like hypothyroidism, Cushing syndrome, growth hormone deficiency. But in these cases, the obesity is usually modest. It does not lead to severe obesity per se, these disease. Along with that, after there are other conditions. There can be genetic conditions which is responsible for obesity in less than 5% of cases. There are so many syndromes like Lawrence-Moore syndrome, Bardet-Biedl syndrome, and Prader-Willi syndrome that can also lead to obesity, and morbid and severe obesity. And many times obesity associated with mental retardation can happen in kids in these genetic syndromes. Along with that, there are certain medications which can increase, especially the corticosteroids. A large number of patients has received corticosteroid during this pandemic, whether required, and many times it was not required, even then it was given. So chronic use of glucocorticoids is also associated with increased incidence of obesity. Along with that, there are certain psychosocial factors and environmental factors which can lead to obesity. So if we plan to tackle this menace, then we have to take all these things into account.
Right. We have to keep all these things into account. The relation that you pointed out between screen time and obesity also quite interesting, especially for the younger population there. Let me take the next question to Dr. Anupam Kumar Singh. Dr. Singh, overweight or obesity is a sort of causative factor, right, for several chronic non-communicable diseases as well, including heart diseases, diabetes. What is basically, according to you, a desirable ideal body weight, or the BMI, or the body mass index as it often talk about? Is that the absolute way in which sort of one sees whether or not one is fit or not?
Actually, obesity is nowadays a pandemic. So it is a problem of every country and even every person in this world. So the point is, like, obesity per se, we measure it in a form of BMI, that is body mass index. It is a ratio of your body weight in kg and divided by your height in meter square. But it is only measure your external obesity or physical obesity. But the other part is internal obesity, and it is more prevalent in a country like India. So, and it is more harmful for cardiovascular system. So the point is, like, what should be the ideal BMI? So there are two basic standard. One is the global standard, or like we follow worldwide. Your basic BMI should be in the range of 18.5 to 24.9. So if you are falling below 18.5, your BMI is below 18.5, you are labeled as underweight. And if your body mass index or BMI is more than 24.9, that is more than 25, it is overweight. If your body mass index is more than 30, it will be labeled as obesity. And if it is more than 35, it will be called as morbid obesity. But countries like India, we actually consider body mass index of more than 23 as overweight and more than 25 as obesity. So your ideal body mass index should be between 18.5 to 23. And if your body mass index is going beyond that, you have to decrease your body weight, because we can't increase your height. So the point is, like, it is all, this BMI is all about your external obesity, but regularly check your internal obesity also. So internal obesity, basically we measure in terms of your metabolic disturbances, like blood sugar level. If you are pre-diabetic or diabetic, or your triglyceride levels are going up, or HDL is going down, even your abdominal girth is increasing, these are a marker of internal obesity. So we have to keep an eye on that also, because that is more important than your physical obesity.
I see. So good to get that distinction over there. Let me take the next question to Dr. Hamid Ashraf there. Dr. Hamid, assessing obesity in children is different and perhaps more complex than in adults, because, you know, children grow and develop at different paces at different ages as well. How exactly should one define obesity measures in a child, or is there a telltale sign on when do you say that the child is just in a phase or actually obese?
Yeah, definitely. It's a very important and pertinent question that we know that we cannot take children as miniature adults. They are different. And as you have already talked, they are growing and the things are dynamic in children. It is not static. And they grow at a different pace during different phases of their growth. For example, pubertal spurt happens at the age of around 13 to 14 years. Then at that time, they grow very fast. So in that situation, definitely there are certain controversies how to measure obesity in children. So different governing bodies have given different guidelines. For example, the World Health Organization tells us that we have to define obesity differently in those who are having age of less than 5 years and those who are having 5 years or more of age. So they define obesity in terms of BMI and standard deviation. In children less than 5 years of age, if the BMI is between 2 to 3 standard deviation, in that situation they are defining it as overweight, and if the BMI is more than 3 standard deviation in children less than 5 years of age, then they define it as obesity. But between 5 to 18 years, if it is more than 1 standard deviation, they define it as overweight, and if it is more than 2 standard deviation, then they define it as presence of obesity. But according to the CDC from US guidelines, they take body weight as a measure of obesity. They are telling that if the body weight is between 85 to 95th centile, then this is taken as overweight, and if it is more than 95th centile, then this is taken as obesity. So it is very important to give growth chart to the patient so as to measure the trajectory of height and weight pattern of a child. So it is responsibility of both the treating doctors and the parents that doctors should give this growth chart to each and every kid who is coming to them, and parents should keep that thing very carefully because that gives us so many indications. It's very cheap, easily available, and it does not, it is non-invasive kind of things. It can be done very easily in all settings. So that helps a lot by giving growth chart to the kids. And there are telltale sign can be there. For example, if the patient is having blackening at the neck, then definitely it tells that patient is having obesity.
I see. So there are telltale signs as well, and then the growth chart can also give us lots of cues over there. Let me take the next question to Dr. Singh. Dr. Singh, I want to move beyond from obesity to actually how it impacts your body, and you want to talk about cholesterol now. And a lot of people by now know that there is a good cholesterol and then there is a bad cholesterol. If you could just dumb it down for our viewers and tell us a difference between the good and the bad cholesterol. And can a person lower their own risk of heart diseases if they lower their overall cholesterol levels, or is there only a section of cholesterol that we need to watch out for?
Actually, nowadays we are considering cholesterol and its like lipid and its derivative like cholesterol and triglyceride as villain. But the fact is that most of our body is formed from the lipid and its derivatives. And physiologically also, most of our hormones and most of our physiological component of enzymes are from the lipid and its derivative. For example, vitamin D, we all are aware about that, is a derivative of cholesterol. So cholesterol is not bad for our body per se, but in excess, in excess it gets deposited in blood vessels and it can cause stroke and heart attack. So the point is like when it gets deposited in our body, and how can we prevent from getting this deposition from our blood vessels? So the point is like there are two things, bad cholesterol and good cholesterol. So the point is like the actually cholesterol per se is water insoluble. To actually carry the cholesterol in our blood vessels, we have some proteins. So these are labeled as different type of proteins. So good and bad cholesterol basically come from LDL. Actually, we label good cholesterol as HDL cholesterol and bad cholesterol as LDL cholesterol. So why it is called as good and bad? So the point is like LDL cholesterol generally carry cholesterol and lipid derivative from liver to the periphery, and it is responsible for deposition of cholesterol in the blood vessel. So it is a villain here. And HDL actually is help in reverse cholesterol transport. That means it actually transfer cholesterol from periphery to liver, and it metabolize the extra cholesterol. So it prevents cholesterol deposition. So the point is like if your HDL is high and LDL is low, that means actually there are less chances of cholesterol deposition in your blood vessels. So point is like it's not about bad and good cholesterol. It's all about your need. So if you eat anything in excess or your calorie intake is more than your requirement, so that will get deposited in your body. So think about your calories, count your calories, and try one extra calorie. And again, high LDL cholesterol level is basically associated with early chances of heart attack and brain stroke, and even particular conditions like familial hypertriglyceridemia and hypercholesterolemia, hereditary conditions, they are associated with high LDL cholesterol, are associated with early actually like premature atherosclerosis and heart attack at early age. So just try to decrease your LDL and increase your HDL. And the most easy way to increase your HDL is exercise.
All right, so simple solutions over there. It's just a matter of getting started with it. That brings me to the next question for Dr. Hamid Ashraf. Dr. Hamid, how does obesity actually develop in children? And is childhood obesity a risk factor for cardiovascular diseases and even diabetes as the child grows up?
Yeah, definitely. As we have already talked about that obesity can lead to different kind of problems, heart problems, dyslipidemia. Childhood obesity is difficult to cure, and ultimately most of the obese child will turn into an adult who is obese. So, and obesity provides a fertile ground for the development of different kind of not only medical condition but also other psychosocial problems in the kids. Medical problems, as you have already discussed, it can be associated with type 2 diabetes. And one of the major epidemiological changes which has happened with type 2 diabetes in last decade or so is that it is now being detected in large number of young children and young adults, which was not there previously. It is a disease of elderly and those who are having age of more than 40 years, but now it is being increasingly detected in small children also. Apart from that, heart disease, dyslipidemia, and cerebral vascular disease, fatty liver, respiratory problems, sleep apnea, and joint problems like osteoarthritis and certain forms of cancer, as you have already talked about, they are quite common with obesity. But this is just one part. Another part is psychosocial problems because of obesity. These children are being bullied by their peers, and they develop some kind of habit to avoid crowded thing, and they want to be at a safe place like their home, and they seek solace from the food intake. And it has been found that obese children, they have less number of friends, and they have less amount of time for play, and they also have poor academic performance. So it affects the overall development of the children. So if we are planning to give a management for obesity, then we just not have to look at the things like medical things. We have to look at the psychosocial issues also.
I see. All right, we're going to continue with this conversation, but let's slip into a quick break. We'll be back with all your questions on health, on diabetes and obesity on the other side. Stay tuned. Welcome back. We are talking about myths and facts and the wellness issue which needs to be really on top of everybody's agenda now, especially post the pandemic. We'll go back to our panelists now. Dr. Anupam Kumar Singh, we were talking about cholesterol before going on break. I want to come back to that. How much cholesterol should a person have per day? And is there a way to actually calculate that, which is more tricky? And which food products do you think contain good cholesterol? And can people eat food containing good cholesterol in large amounts?
Actually, again, here there are some myths and facts on this question also. The point is like, it's not about 1:1 relationship. If we eat cholesterol, it will get deposited as cholesterol. If we eat protein, it will get deposited as protein. It's not like that. The major source of cholesterol in our body is liver. So it's not the diet that is responsible for major cholesterol in our body. The point is like, again, it's your calorie, because there are three basic calorie actually your fuel in the body. So these are carbohydrate, fat and protein. So the point is like, we can't say that this particular grams or this particular amount of cholesterol you should eat. We generally talking about the ratios. So your total calorie intake should not be more than 10% in form of fat, or particularly saturated fat. Then actually basically we derive our calories from carbohydrates. So your carbohydrate intake should be like 40 to 60% of your calories. Your protein should be 20 to 30%, and your fat should be like 10 to 15%. But desirably, your saturated fat intake should be less than 10%. So the point is like, if we will keep our calories intake in the balance, and if we will maintain the ratio, our LDL cholesterol will be in the check. Again, the foods which are actually rich in HDL, or that decreases the level of LDL, there are some foods, particularly fish, rich in omega-3 fatty acid. They are found to decrease the LDL and obviously risk of heart diseases. So the point is like, it's not basically it's not the food, it's your requirement and actually your intake. So just avoid junk foods, extra concentrated calories. Processed food are the rich source of calories. So just try to avoid as much as possible your processed food intake in the form of calories. And again, try to take raw foods that will actually decrease the calorie intake, and do regular exercise that will increase your HDL and decrease your HDL.
I see. So it's the fast food, highly processed food and the rest of it that should really you be keeping a watch out for. Let me take the next question to Dr. Hamid. Dr. Hamid, should bariatric surgery be considered important as a therapeutic option, at least in obese people with diabetes?
Yeah, bariatric surgery is an option just not for obese people with diabetes, even those people who are morbidly obese, meaning thereby if they have BMI of more than 40 kg per meter square, even in absence of diabetes and hypertension or heart disease, they are candidate for bariatric surgery. The problem with the bariatric surgery at this moment in our country is accessibility, availability, and affordability, because many patients cannot afford that kind of surgery, and it is not routinely available across the country. Big hospitals, it is easily available, but in peripheries and rural areas and at a small district level, this is not easily available. So the criteria for this bariatric surgery is according to the BMI levels. If a BMI is more than 40, irrespective of the comorbid conditions, patient can be subjected to surgery if they are fit enough for surgery and they are highly motivated to undergo surgery, and whatever the process which will follow prior, during and after the surgery, if they are able to follow that process, then definitely they can be subjected to surgery. And according to recent guidelines, even if the BMI is more than 27.5 kg per meter square, this is the guidelines from International Diabetic Federation. In South Asians, if the BMI is more than this much and patient is having difficulty controlled diabetes, hypertension, or patient is having severe issues with their heart and all those things, in that situation, bariatric surgery is definitely a good option, because it leads to significant weight loss. Around 25 to 40% of sustained weight loss can be achieved by different kind of bariatric surgery which is being performed. While the lifestyle intervention at max, they reduce the weight by 10% at 1 year, and this efficacy reduces to 5 to 6% or 5 to 8% at the duration of 8 years.
All right, Dr. Kumar Singh, Dr. Anupam Kumar Singh and Dr. Hamid Ashraf, that's all the time we have on the program today. Thank you so much for all your answers. Thanks so much for joining us. Goodbye for now.